Hello, Scott Jensen here. Well, let me just say it clear. I've been wrong during the COVID pandemic. I've admitted it. Let me give you an example. I remember in the early days when the question was, what about the origin of the COVID-19 virus, the Wuhan virus? Where did it come from? Was it a lab leak? Did it come from a spontaneous reassortment of RNA in different species? Did it have to do with the marketplace in Wuhan that had live animals as food sources potentially for sale and potentially pets for sale? If you said that it was anything other than a spontaneous reassortment related potentially to the marketplace in Wuhan, you were frequently labeled as a conspiracy theorist. Well, recently there's been a lot of hullabaloo about what's the origin. Yesterday in the New York Times, Cheryl Stolberg and Benjamin Mueller wrote an article talking about what's the origin of the COVID-19 virus. And they referenced the scientific phenomenon known as zoonotic spillover. Zoonotic referring to condition dealing with animals, and a spillover whereby you would have this potential recombination or reassortment of RNA virus. But they also reference the fact now that the Department of Energy, as well as the FBI, has said that they believe it is more likely a laboratory leak. I initially, for the first year, was pretty clear that I thought that the COVID-19 virus originated in a spontaneous reassortment. We know that happens in nature. But I remember it was in the spring of 2021, Robert Redfield, the former director of the CDC, who was no longer in that position, came out and made some reference to the fact that he was no longer as certain about the origin of the COVID-19 virus as he had been. And when he said that, that really made me stop and think, because he was much more, if you will, at ground zero, in the know. And when he said it, I started to think about it. And now I would say that my position has shifted. I think that there's a greater than 50-50 likelihood that this indeed came from a laboratory. I still don't think we know for sure, but I would go so far as to say that right now I think that 75% chance of that this was indeed created in a lab where they were doing experimentation with viruses. I remember Tony Fauci said that he wasn't involved in gain of function. I wonder if he's sticking with that. But the point I'm trying to make is that, yeah, I've been wrong, and I try to admit it when I am. But I think that most people want to see us move forward around the planet on the COVID-19 pandemic. It's been 3 years. And I think one of the key issues is going to be, can we start to be more careful in terms of making a distinction between misinformation and disinformation? If you go to Merriam-Webster Dictionary, go to Google, go to a variety of encyclopedias. I did that this morning. I looked at about 10 different resources. Misinformation is frequently identified as incorrect information. Oftentimes, information that you say on a Monday, if it's proved incorrect on Wednesday, by Friday it might be identified as misinformation, even though when you shared it on Monday, you thought it was the truth. That happens. Take Tony Fauci in the early part of the pandemic. If you remember, Tony Fauci came out and said, masks don't have any use. Don't wear masks. Save them for the healthcare workers. They're not going to prevent you from getting the disease. But a few months later, Tony Fauci was on the bandwagon of, hey, you're beating the drum. We got to wear masks. Everybody wear masks. And remember the famous time where he was at a baseball game and really wasn't wearing his mask, even though he was now on record saying we all have to wear masks. And he said, well, he was going to get a drink from his beverage or whatever. The bottom line is, I'm going to guess that when he first said it, I would have thought that that was not disinformation. That was what he thought made sense. And then 4 months later, he changed his mind. Now, when he said 4 months later we should all wear masks, I don't know if that was misinformation, or when he said 4 months later that we should wear masks. Was that correcting what he said 4 months earlier, or was that now disinformation? Was he trying to deliberately mislead? Because recently the New York Times has published an article Truth Unmasked at last, Brett Stevens, and it comes out and says, on a mass scale with human error, masks don't do much at all. The bottom line is misinformation and disinformation are two different things. Misinformation is incorrect information. More science comes forward, more data comes forward, more information comes forward. Disinformation, when you look at Merriam-Webster, think of the D for disinformation, think of the D for deliberate. It has to do with intent. Disinformation is, if you will, an effort to mislead. The intent is to mislead. The author understands that the information being shared is not correct. It is not his or her truth at that point in time. This really matters because, as I mentioned, the New York Times today comes out and talks about the origin of the virus. I think this is terribly important that we understand this. I understand that China in many newspapers now is being quoted, some of the spokespeople from China saying that they're not happy at all with this recent trend in discussion. But of course they wouldn't be happy. The last thing the Chinese people want to know, or the China government wants to deal with, is having to be defending themselves against potentially a lab leak or something like that. But Marty McCary is a doctor, a physician, and a professor at Johns Hopkins. And he wrote an article yesterday, and he commented on the whole issue of what about the COVID experts and the things that they said that have now been debunked. He calls it, I think, accurately, he says, these are misinformation. So let's just run through these by Marty McCary. I think he's been quite a cogent, prescient voice throughout the pandemic. So he says, number one, misinformation number one, natural immunity offers little protection compared to vaccinated immunity. Well, a Lancet studies come out and said that that's not true. And he goes in and he quotes it. Even in, I think it was 430 BC, almost 500 years before Jesus Christ, it had been observed that those who recovered after an infection were protected against severe disease if reinfected in regards to the Athenian plague. He goes on to say then, misinformation number two, masks prevent COVID transmission. I noticed that in the Minneapolis Star-Tribune today, the editorial position was that masks shouldn't be denigrated or something like that. Bottom line is, masks do not prevent transmission. That's the bottom line. Can they help? Can they mitigate? Sure they can. There is a lattice structure to any mask, whether you're talking about an N95, a surgical mask, or a cotton mask. There's a lattice structure. There's a pore size. There's an opening. How big is the opening? In most cotton masks, the opening is about 50 times bigger than a COVID particle. That's why people have said intuitively it doesn't make sense that a cotton or surgical mask would give you 100% protection. But it might give you 10, 12%, maybe it gives you 20%. Maybe an N95 mask gives you 70%. Now, I don't know that that's exactly the case, but the bottom line is it does not prevent transmission, and it does not provide you an ironclad guarantee that you're not going to get the disease. Another misinformation piece that Marty McCary comes, school closures reduce COVID transmission. And he goes on to say that the CDC ignored the European experience of keeping schools open and most without mask mandates. Transmission rates were no different, evidenced by studies conducted in Spain and Sweden. Misinformation number four, myocarditis from the vaccine is less common than from the infection. Well, no, that's not true either. It's actually looking like myocarditis related to vaccines is more common than the infection. And he goes on to speak that. But when someone said that, was that disinformation or was it their best information at the time? Misinformation number five, according to Dr. McCary, young people benefit from a vaccine booster. You can think about that one on your own. This article is yesterday, February 27th, in the New York Post. Marty McCary, M-A-K-A-R-Y. Misinformation number six, vaccine mandates increased vaccination rates. And he talks about the fact that that may not necessarily have been the case. Misinformation number seven, COVID originating from the Wuhan lab is a conspiracy theory. It's not a conspiracy theory. There's an absolute reasonable conversation to be had. Misinformation number eight, it was important to get the second vaccine dose 3 or 4 weeks after the first dose. Well, he comments that spacing the vaccine out by 3 to 4 months reduces complication rates and increases immunity. So again, misinformation, disinformation. Think about it. Misinformation number 9. Data on the bivalent vaccine is crystal clear. Think about that one. The bivalent vaccine, that's the one that's recently been out that gives you protection against 2 different kinds of spike proteins. And then the misinformation number 10, 1 in 5 people get long COVID. And he comments that a study in the United Kingdom indicates that 3% of COVID patients had residual symptoms lasting 12 weeks. And then he comments on what explains the disparity. Tony Fauci recently was he was one of the authors in an article in Cell, Host, and Microbe. And this is what this article said in regards to the vaccine. The COVID vaccine said, the vaccines for these 2 very different viruses, the influenza virus and the COVID-19 virus. The vaccine for these 2 very different viruses have common characteristics. This is in the article. They elicit incomplete and short-lived protection against evolving virus variants that escape population immunity. That was a big deal. I think Tony Fauci there was starting to say, okay, mea culpa, mea culpa. He might have said some things about the vaccines that may have represented misinformation. Again, I think we have to be careful about saying that that's disinformation. I remember when Tony Fauci was saying that if we got 60% of the people vaccinated, we'd have herd immunity. Then it was 70, then it was 75. And when he was confronted about why he kept changing his number and sounding like an auctioneer, he said, well, he felt that would be the easiest way for the American people to find what he had to really say palatable. So he didn't want to start right out at 80 or 85%. He wanted to start out lower so he could sort of ease people into the reality of what he was thinking. Perhaps that was not misinformation there. Perhaps that was disinformation. I'm not going to make that distinction. Today, I received this journal, the American Journal of Medicine. This one is volume 136, number 2, February 2023. Misinformation or disinformation. This is an article written by Donald Redelmeyer, a physician, Jonathan Wang, he's got some degrees and letters after his name, but he doesn't say MD, and Diva Thirukovim. She's also, looks like a master's in science or something. This is an article, and here's what it says. The title of it is COVID Vaccine Hesitancy and Risk of a Traffic Crash. COVID vaccine hesitancy and risk of a traffic crash. Background. We tested whether COVID vaccination was associated with the risks of a traffic crash. Methods. We conducted a population-based longitudinal cohort analysis of adults and determined COVID vaccination status through linkages to individual electronic medical records. So they were able to somehow get a link to an electronic medical record and find out who had been vaccinated. That's interesting. Here's the results. A total of 11,270,763 individuals were included, of whom 16% had not received a COVID vaccine, and 84% had received a COVID vaccine. The cohort accounted for 6,682 traffic crashes during follow-up. Unvaccinated individuals, remember 16%? Unvaccinated individuals accounted for 1,682 traffic crashes, 25%, equal to a 72% increased relative risk compared with those vaccinated. The increased traffic risks among unvaccinated individuals extended to diverse subgroups was similar to the relative risk associated with sleep apnea and was equal to a 48% increase after adjustment for age, sex, home, location, socioeconomic status, and medical diagnoses. Then it says this. The increased risks extended across the spectrum of crash severity, appeared similar for Pfizer, Moderna, or other vaccines, and were validated in supplementary analyses of crossover cases, propensity scores, and additional controls. This sounds terribly official. Conclusion. These data suggest that COVID vaccine hesitancy is associated with significant increased risks of a traffic crash. The article is many pages long. They've got some very official looking graphs. They've got some nice XY graphs here. They've got characteristics. And then they've got all kinds of information. I mean, you could spend a day and a half probably reviewing this whole thing. But at the end, here's what it says. The observed risks are sufficiently large that paramedics, emergency staff, and other first responders should be aware that unvaccinated patients are overrepresented in the aftermath of a traffic crash. So if you're taking care of a traffic crash victim, unvaccinated individuals are overrepresented in that group. What is that saying? That's where it gets a little devious. Misinformation, disinformation. I think we've got a lot of work to do, not just as a medical profession, though we certainly do, but we have to hold accountable big government and the supposed experts, big pharma with its supposed ironclad evidence of safety and effectiveness for the vaccines, as well as big tech with its almost unrelenting willingness to do whatever was necessary to squash the contrarian discussion, the contrarian narrative, the skeptical viewpoint. Big tech, big pharma, big government, they're a problem. The experts, they're a problem. Folks, our world has been wounded by the COVID pandemic in way more ways than we ever thought possible. We are going to have to move forward at some level. We are going to have to start making a very clear distinction between what is misinformation, simply information that was shared a few days ago, weeks ago, months ago, or years ago, that may well have been thought to be true, but was found to not be true. That's misinformation. Disinformation, totally different animal. Disinformation is sharing something that you know is not the case, and you do it deliberately to mislead. Now, you might think that you're misleading for the greater good of society across the world. But I would say this. I have been willing to admit when I was wrong. I think I was right that lock-ins were a lousy idea, that locking nursing home patients in the nursing home so that they would die miserable deaths, locking down businesses didn't work, locking out kids from school didn't work. The origin of the virus, I was wrong on that. I thought clearly that that was a natural reassortment, and I don't know anymore. But I do think that one size fits all was a bad idea from a policy perspective. I also think that the idea of what we did to nursing home patients is horrific, and we'll have to live with that for the remainder of our lives. I think the goalposts of flattening the curve and not overwhelming healthcare facilities, when they were moved and all of a sudden what we were told was going to be a short-lived lockdown didn't come to be, I think that we had every right to say that, hey, that wasn't correct. I think when we looked at the models that weren't anywhere near accurate, that's a problem. When we looked at the mandates that didn't accomplish what they said they would, when we look at people who were told that if you wear a mask, you won't get COVID-19, and that didn't happen, that was wrong. I think that when we looked at the epidemic of fear that seemed to be driving the entire program, I think that was wrong. I think that when we had the government expanding its powers through emergency powers and continued to hold on to those and use them as negotiating ploys as they tried to get budgetary issues settled, I think that was wrong. I think when we looked at tracing and we look at testing with the high cycle threshold of the PCR, I think that was wrong. I think when we brought the immunization programs out and treated it like lottery, get a shot, get $100, get a concert ticket, go to a sporting event, I think that was wrong. I think natural immunity being bashed for 2 or 3 years, and then finally we're coming forward now and recognizing that natural immunity indeed is a real thing, I think that was wrong. And I think gain-of-function research is happening. I don't think I was wrong on that. Gain-of-function research isn't just about making a virus more transmissible or more virulent. Gain-of-function also includes when you try to take a virus and make it target a different population group, maybe a population group, instead of being elderly, frail people over the age of 70, have it target the 20 to 40-year-olds. What would that do to devastate a nation? That was one of the key things about the 1918 swine flu pandemic. That targeted younger people, devastated nations for generations. Folks, there's a huge difference between misinformation and disinformation. And I think you need to start asking yourself as you're watching people, are they willing to admit when they're wrong or not? I think recently we've seen a real lot of coverage regarding the whole thing with the origin of the COVID-19 virus. We've got the FBI and the Department of Energy saying, we think it came from the lab. We've got other organizations such as the CDC and the World Health Organization saying, we don't think so. And we did do a study. Never mind that perhaps as much as 50% of that World Health Organization study group that wrote the paper that they thought it was a natural reassortment may well have been from China or the area. These things need to be discussed. I'm no conspiracy theorist, and I'm not spreading disinformation. In a week, we might know that something I said today turned out to not be true. If that's the case, go ahead, classify it as misinformation. But the medical profession has absolutely stumbled. When you see someone trying to make a point that if you don't get vaccinated, you're more likely to be involved in traffic crashes, and then you give a warning to the people who have to respond to traffic accident victims, at what level of Machiavellian behavior are we bowing to? Think about it. If we're wrong, let's admit it. If we're looking at something that turns out to not be true, let's be careful before we throw that accusation out there of disinformation. Misinformation, recognizing the fact that today's truth might be wrong in a week or a month or a year or a decade or a century. Yeah, that happens. But disinformation, the deliberate spreading of falsehoods that you know are false to mislead, whole different animal. If we can't have these kinds of conversations like we're having right here, I don't know why you'd think that we have any hope at all. Think about it.